County is reporting its first human case of West Nile virus of the year. That is according to an announcement today from Austin Public Health. West Nile is the most common mosquito-borne disease in the U.S., and you can get it from the bite of an infected mosquito.
So far this year, 10 mosquito pools in Travis County have tested positive for the virus. We are joined now by Rina Solanki, senior epidemiologist with Austin Public Health. Rina, thank you so much for being with us.
Oh, thank you.
So does this case in Travis County suggest we're likely to see more West Nile activity in our area?
Potentially. This is pretty normal for the past few years, so this isn't anything out of the ordinary that we would see.
And I know that details about this particular patient may not be able to be shared, but I'm curious if you could share what are the symptoms that people should watch out for should they suspect that they might have West Nile virus?
Yeah, so oftentimes, like over 80% of people don't actually show any symptoms, but the ones that do show symptoms tend to be like mild flu-like symptoms, which I know looks like everything else. So I would say if you were concerned and you had mild flu-like symptoms, but you were around mosquitoes, you should go talk to your healthcare provider and they can, determine if you need testing or not. I will note that approximately 1% of people can get a very severe illness. These tend to be people over the age of 70 and people with immune compromising conditions. They can have symptoms like neurological symptoms, paralysis, and even death. So it can be a very severe illness for some.
Remind folks, can West Nile be spread from person to person, or is that mosquito bite the primary concern?
Yeah, no, it cannot spread person to person. The mosquito bite is the primary way that you would get West Nile.
And I know that in announcing this human case here in Travis County, you also shared some prevention tools and maybe steps people can take at their own properties and homes to try to fend off mosquitoes there. So remind people again what they can do to try to stop that.
Yeah, so if you're out in your yard and you notice any standing water, this can be in tires, even your plant pots. You want to dump them once a week, just so you don't get mosquitoes breeding. Dusk and dawn, those are times when the mosquito is most active. So if you're going out at that time, wear an insect repellent. If you're going to be outside, you want to dress in like loose fitting clothing, wear long sleeves, long pants, and then, like I noted beforehand, wearing an insect repellent. One of the EPA registered ones. I personally like to use DEET, but there are different insect repellents that work for West Nile virus as well.
Great reminders for what people can be doing to protect themselves. We want to ask, what is Austin Public Health doing in response to this first reported case?
Yeah, so it's just typical what they do every mosquito season. So they do some increased surveillance in areas that tested positive for a mosquito pool. They might put up, or not might, they do put up signs and alerts to alert, neighborhood residents that there is a positive mosquito there so that they can, be more aware and protect themselves. Sometimes they'll do larvicide in like ponds or lakes, but Austin Public Health, or the city of Austin, does not do spraying.
And Rina, in these final few moments here, I'm wondering, people might hear about this first human case and think, oh gosh, I really need to worry about this now. So what would you say is the amount of concern that people should have about contracting West Nile virus?
I mean, during mosquito season, it is a concern, regularly. But if you're protecting yourself, then I think there's less of a reason for you to be concerned. So if you are concerned and want to prevent yourself from getting West Nile virus or any other vector-borne disease, wear long sleeves, use insecticide if you're going to be outside, or insect repellent.
Yeah, such good reminders. Rina with Austin Public Health, thank you so much for coming on and putting it into perspective for us so that we know what people should be doing to stay prepared.
Yes, thank you so much.